Confederation put a report out for its conference in June called Dealing with the Downturn, and we looked within that report at a lot of things that history has shown us may or may not work when dealing with the sorts of financial pressures. And I have to say this is a pretty unprecedented financial pressure that we're going to be under. Some of what we came up with was a what not to do list. And what not to do in terms of financial pressure is to start looking at quality and trying to dilute it. Trying to save money by diluting quality seems to have very dire effects on the services, particularly around patient safety, around patient experience again, and around clinical effectiveness, three things that the previous speaker mentioned. Slash and burn doesn't seem to work. Salami slicing certainly doesn't work. The whole idea that you can take a little bit off everything and get something at the end that adds up to the sum of the whole just by making efficiencies doesn't get you as far as you would think on first sight it might. It is more about focus, and it is very clearly around making some very difficult choices about what the NHS stops doing. Because we will have to make some choices about what the NHS stops doing. And some of these are going to be easy, but a lot of them are going to be very difficult to make. A lot of them are going to need new ways of looking at that. And public health and the evidence base behind public health interventions is going to be really important to make sure that what we don't get are things just cut uniformly across the piece. Both of previous speakers have mentioned not cutting training, and I would echo that again. Very much you need people skilled up, and you could say that if you've got to make some of these difficult decisions, you need people more skilled than maybe you would in times when the money is plentiful and you can experiment a little more with the way in which you put things together. You shouldn't cut prevention. That doesn't seem to work either. But you do have to deal with the double running cost issues that you will get. You do have to deal with the fact that you have a short-term and a long-term agenda. And as somebody mentioned recently, the tenure of a chief executive in the NHS is somewhere shy of about 2.5 years. How do you get a service that thinks in the long term in that situation? Particularly, how do you get PCTs, who have been in constant reorganisation over the past few years, to think in long term when actually the people at the top of the shop may only be there for 2 or 3 years at most on average. And the last thing you want to do is rearrange the deck chairs. Interestingly, at the moment, we have a bit of deck chair reorganisation going on, and it's called Transforming Community Services. And this is the first time, actually, there's been quite a major reorganisation within the NHS, which is, we're told, not a reorganisation. It is where I stand from, I have to say. This is the divestment of community provider services, who are actually key givers of public health and health promotion information, out of PCTs. I think we have to watch this one. I think we have to make sure that what we don't get are fragmented services, just at the time when we need services who cooperate, who work in partnerships at local level, and can actually deal with the whole range of issues that we have to deal with. If we get a Conservative government in next year, then there is a commitment within there to hard budgets for practice-based commissioners. Hard budgets meaning that the money goes straight down into practice-based commissioning funds rather than overarchingly being controlled by the PCT. That means we really do have to get the collaborative commissioning that Hamish talked about up and running, because if not, what we're going to get is further fragmentation. If we have large collaborative commissioning groups, then is that not a further reorganisation? Are we not taking away from the system we have at the moment? Do we really need that in a situation where we need strong partnership and good collaborative decisions making? And finally, we have been reorganising the regulatory system, again, on and off for quite a long time. And if we're clear that one thing we don't want to do is cut quality is dilute quality, then we need a strong, robust and sustainable regulatory system that will enable us to make some of the decisions we have to make and hold us to account for some of the issues around quality that they may give rise to.